So paramedics have been in primary care since about 2001 in the UK, and it's a really exciting opportunity for paramedics to move away from their traditional employer, the ambulance service, into a new clinical setting. However, that means that quite often there's not the clinical guidelines or sometimes the clinical support that paramedics have benefited from in the ambulance service. And what is really interesting is that the three editors, so Joe, Alicia and I, were all working in separate places, different parts of the country, in primary care independently over the last 5 years. And Joe had this idea for this book in about 2019 and brought us on board with it essentially. And it was an opportunity to give current paramedics in primary care something that we never had when we moved into primary care 5 years ago. And I think that was really important to us because transitioning from an ambulance service into a primary care environment is quite difficult, and if I'd have had a book that laid out different clinical presentations, different examination techniques, it would have really helped me to streamline my practice a lot earlier on. And we all found, Joe, Alicia and I, we all found that this was a common theme between us. So it's really an opportunity to give other paramedics in this clinical setting something that we wish we'd had. So Paramedics in Primary Care is unique because it's a clinical book edited by paramedics for paramedics, and the chapter authors represent paramedics. We've got a few A&Ps, we've got some GPs who have a specialist interest in the chapter topic that they're writing in, and I really think that passion and that expertise really comes through. And I'm really proud of the fact that we're at a point in our profession as paramedics that paramedics are not only working in primary care but they're specialising in different systems. So, and I think that's really important for the profession, and I'm really proud that we could capture that in the authorship for this book. Paramedics in Primary Care, the clinical conditions that are in there matches the roadmap that's produced by Health Education England for first contact practitioner paramedics and advanced paramedics working in primary care. But it doesn't matter if you're not in England and you're not following that roadmap, because these are still the core conditions, the core competencies and the core examination skills that paramedics across the country and actually outside of the UK would face whilst working in primary care. So it's a really generalisable insight into the type of clinical work paramedics are doing in this space.